Greetings to you. My name is Corinna Maharani. I'm an Ayurvedic practitioner with 30 years of experience practicing and performing PanchaKarma and Marma therapy. And I'm very excited to talk to you today about osteoporosis. I had the great honor to study under the guidance of Vaidya Ramakat Mishra from the Honorable Chakravansiya lineage for almost 3 decades. And it is from that lineage that I hope to offer some insights on how do we aid the symptoms and help support patients with panchakarma who suffer from osteoporosis. And as part of the presentation, I'll give you a brief overview on osteoporosis from the viewpoints of our lineage, but also talk to you about different panchakarma therapies, how they are helpful, and then share with you a brief protocol on Marma therapy that you can use with your clients right away. And I hope you find this presentation interesting. So without further ado, I love to just jump right in and begin to just share a few slides with you. Of course, first, it's always important to mention that none of the information here is meant to be constituted as medical advice, which is always intended and always reserved to be given by a medical professional. So this is for education purposes only, and I hope you enjoy the following. So osteoporosis is a disease close to my heart because my family had conditions, my grandparents and father, of quite severe cases of osteoporosis, which made me want to study this in greater depth. It's actually a fact that 200 million people suffer from osteoporosis. And by the age of 60, about 50% of all women, so every second woman, suffers from osteoporosis, and about 1/3 of men. By the age of 90, 2/3 of women suffer from osteoporosis, but often the condition isn't really noticed until perhaps an accident occurs and a fracture occurs. So it's important for us to try to prevent the occurrence of osteoporosis and aid people's discomfort and further deterioration of the bone tissue through the help of panchakarma. And the beauty and the light that Ayurveda shines on this condition is that we say that the body is like a river. It is constantly in a state of flux. And at about any moment in time, 2 to 5% of the entire skeletal system is being removed, remodeled, is being renewed. And so there is an opportunity for us to really address the body's ability to grow healthy bone tissue or to prevent too much loss of bone density, because there is this constant renewal happening. And so what is, as you surely know, the cause of osteoporosis is that there are two cells responsible for the replacement and rebuild of bone tissue. And the two cells are the osteoblasts and the osteoclasts. In osteoporosis, the bone formation of the osteoblast does not match the extent of bone resorption of osteoclasts. And so here we have an issue where there is either too much of a reduction of bone tissue occurring or not enough build-up of healthy bone tissue occurring. Either way, there is an imbalance, or both conditions could be present. And so with panchakarma, the detoxification, and the rasayana therapies, the rebuilding therapies of Ayurveda, we aim to improve this condition. So I will soon share with you a little bit more on how. But just briefly, what causes this condition and how do we address that? So one of the causes is a low level of inflammation. So detoxification is very crucial because it is the toxicity in the body that is the root cause of inflammatory, reactions in the body. Toxins can congest the shrotas, or the body's channels, and these toxins that are being that are congesting our channels then cause the inflammation. In PanchaKarma, we of course detoxify the body from many toxins, which is very helpful for osteoporosis. We also use lubrication hydration as a tool to combat inflammation. So there are specific medicated oils, which I will talk to in a few minutes, and also several other decoctions that are of great importance that help soothe and lubricate the tissues and help reduce vata-related inflammation, which stems from excess dryness and really worsens the conditions of osteoporosis. The purification and rejuvenation techniques of Santa Barbara are working together. We do not only eliminate toxins, which are the cause of much of the inflammation, but we also strengthen the existing bone tissue, the immune system, and therefore reducing the likelihood of future inflammatory responses. So while the body's impact, there's a lot we can do to reduce the symptoms and the condition of osteoporosis, we also need to take into account that much of the physical inflammation that we experience begins in the emotional body, in the mental body. And so the body-mind connection is being addressed in PanchaKarma by offering soothing therapies and treatments that help reduce stress and tension, and therefore creating a very beneficial foundation for our body to function properly. Now, we know that, high AMA, or lots of toxicity in the body, often stems from a bad or not well-functioning digestive system. And so it's really important for us to address the health of the bones by looking more closely at the digestive fire, because it's in the digestive fire that much of the formation of the bone tissue occurs. So it relies on a healthy digestive fire. So the digestive fire, also called Agni, of course, breaks down the substances in the body, such as toxins, and helps to eliminate them from the body. And if we don't have a good digestive fire, we may accumulate too many toxins, which then cause, again, inflammation. But also, Agni is there to help us break down the foods that we eat and turn the nutrients from the food into functioning bone tissue. So a good Agni system is crucial for the build-up of good bone tissue and for the removal of toxins from the body. And that is something that will help kindle in the PanchaKarma process. So an impaired transformation and assimilation of food will hinder the transformation of proper bone tissue. And we know that when the digestive fire is weak or imbalanced, it leads to improper digestion and assimilation of nutrients, affecting subsequently the creation of astidhatu, which leans upon the formation of all the previous tissues to be done successfully. So if we don't have a good digestive system, we cannot form good bone tissue. So the restoration of Agni is crucial as part of the process in dealing with osteoporosis. Now we know that osteoporosis usually impacts people past their menopausal years or after surgery of the uterus or ovaries, because the body's production of estrogen declines then significantly. And this reduction in estrogen disrupts the delicate hormonal balance and the function of the bone resorption and formation. And so without sufficient estrogen, the rate of bone resorption begins to outpace the rate of bone formation. And that is very important because we need to have healthy bone tissue. This, of course, hits, of course, the Vata body types very strongly because they tend to have lighter bones and a lighter frame and a little more of a brittle body type. And it happens to us in Vata time of life when we are older, past midlife. So It is really a Vata type of condition. Yet again, as I mentioned, inflammation is an important part of the problem. In the Swa lineage, we take a great care of the liver because the metabolism of estrogen happens through the liver. The liver is responsible for metabolizing and detoxifying hormones, and that includes estrogen. And so estrogen is crucial for maintaining bone density. And so it's understood that if the liver doesn't function properly, the metabolism of estrogen becomes impaired. And in today's society, most people have a compromised liver because life is just too inflammatory causing. So we're taking great care of our liver through several avenues that I'll explain in a minute. Also, the formation of all the other tissues, in particular, rasa and rakta dhatu, the lymph and the blood tissue, are of great importance when it comes to dealing with osteoporosis. So rasa, the fluid part of the body, is there to nurture, flourish, and hydrate all the tissues. And that includes, of course, the bone tissue. And if the liver is congested or not functioning well, the quality of these lymph fluids in our body leads to poor nourishment of the bone and therefore increases the risk of osteoporosis. The liver is also responsible for good quality blood. And so a heated liver causes hot, acidic, inflammatory blood, which then again begins to help break down too much of the bone tissues. Also, calcium, vitamin D deficiency is something that needs to be addressed. The liver plays an important role here because it activates the vitamin D, which is essential for the absorption of calcium in our body. So without sufficient vitamin D, calcium cannot be effectively absorbed from the diet, leading to weakness in the bone. And it is not enough to just take a supplement. And specifically, calcium is considered to be a very coarse and difficult supplement to be absorbed. If it's not prepared properly, like Svalini prepares the coral calcium, which is like a basma, which has a much greater ability to actually penetrate into the body, while the regular calcium would just add plaque to the channels of the bodies. So, and we need to take into account, again, for liver health, how important is it that we balance Vata and Pitta dosha? And the liver is the seat of Pitta dosha, or Pitta is very much relating to the liver. It's a hot organ, as you would say. And so it's important to reduce Pitta's heat and to nurture and moisten and lubricate our body enough so that Vata dosha is also being reduced so that the bone tissue can really be formed healthily. So a few things for the liver that I recommend to all my PanchaKarma clients. That is, of course, the dietary choices that include eating a diet that is good for liver health, that is cooling, bitter, and detoxifying, and that helps balance Pitta dosha and therefore supports the liver function. There are herbal supports that we give. In Ayurveda, we prescribe lots of gently liver purifying herbs that are not they're not agitating to the liver, they're not difficult to absorb. We often lean on transdermal absorption, really more to that in a minute. And we support the overall hormones and nutrient metabolism through herbal support. We offer lifestyle practices such as yoga, exercises to maintain healthy liver health, and of course, avoid things that agitate the liver, such as pitta agitating foods, alcohol, coffee, and so on. And then periodic detoxification of the liver through PanchaKarma therapies can really make an incredible impact on osteoporosis. So a few PanchaKarma therapies I want to mention here in greater depth that I find to be of great help, and I'll talk to you a little bit more about that now. So snehana, or the oleation therapies of PanchaKarma, are of course very important. Sometimes we oleate the body internally, and we may do that by consuming, you know, medicated substances, like ghee, for example, is very common, known to be a very lubricating substance for the joints and bones, and it has a very balancing effect on the lightness of Vata dosha. Then it is infused with, for example, ashwagandha. But we're also using external snehana in form of abhyanga or oil massage, with oils that help reduce Vata dosha, or that help with pain and discomfort and really help the mineral content of the bone, like Maharani oil, or of course Dhanvantari Tailam, very wonderful oils that can be used for the body. And we know that the benefits of sesame oil are great. It's rich in calcium, it's rich in minerals, it gets absorbed to the skin, it has a very small molecular structure, and therefore gets absorbed into the bloodstream with great effectiveness, and can be absorbed in the bloodstream in as little as 7 hours. So if the sesame oil is herbalized, for example, here with the Cherabala oil, which is an oil made out of bala, which is an herb designed to bring strength about, and milk, or ashwagandha oil, then these can be absorbed into the body through the tissues, helping with the lubrication of the joints and enhancing bone strength. Now we know that in SWA, we believe that sometimes the transdermal absorption is key in order to do PanchaKarma safely. Because when we absorb things to the skin, like in Abhyanga, we do not suffer from any side effects. We bypass the often compromised liver system, and we absorb the herbs directly into the blood and circulatory system, again, bypassing the digestive system and not overburdening the same. So we are not really promoting a lot of, herb, ingesting a lot of supplements or so, and particularly not any that are not prepared in the proper way. The other thing in PanchaKarma that is very helpful is Svedana, which is the sweat processes, which helps soften the tissue. It helps bring about a widening of the channels, and with that allow the detoxification process to take place. The softening and the widening of the elimination channels and the shrotas helps also the removal of the toxins that are accumulated in the body and perhaps in the bones. And so this is a very important cleansing therapy, and it also aids in pain and discomfort, of course. Now, Basti is of great importance, the medicated oil enemas. I had great success treating my PanchaKarma clients with Bastis. The oil Bastis, herbalized with a variety of herbs, these are Dashmula, the 10 different herbs, or again, Bala Ashwagandha, can be very, very nurturing to the Vata dosha, which is symbolic of the porousness of the bones. So Vata dosha resides in the colon very prominently. So if we use Bastis, usually a great impact can be seen, and the reduction of Vata dosha, and therefore an improvement in osteoporosis can be noticed. There's a lot of research about that available on Google. An Asti Basti is a Basti that is infused with herbs particularly designed to help strengthen bone tissue. And when you perform a Basti, you want to do it for a period of time to see results. So for about 6 to 12 months, you want to do a little oil enema quite regularly, ideally, at least once or twice a week. And you use about 4 to 8 cups of sesame oil. That could be plain sesame oil, or could be herbalized sesame oil with the herbs mentioned here. And you can also do a Basti daily going through PanchaKarma, which will help to nurture your body deep within, strengthen your entire physiology through the healing of the sesame oil and the herbs that will be then absorbed right directly to the colon wall and helping you build proper bone tissue. Now, the herbal preparations and medicated oils and ghees that we use are really meant to be have to generate and fortify the bones. And when you use these herbs in combination with the oil bastis, then you really see incredible results. So even taking the combination of internal oils and ingesting the herbs can show improvement in as little as 2 to 3 weeks. So this is a very powerful combination and highly recommended. And during PanchaKarma, it is wonderful to guide your patient in both directions simultaneously, using herbs like Shatafari, Guduchi, Amalaki, Ashwagandha, Bala. So let's talk a little bit about the protocol that I use for my PanchaKarma clients to treat them with osteoporosis. So first of all, the Marma therapy protocol here is designed to pacify the Vata dosha, which is of course linked to the lightness and dryness and brittleness of the bones. So Marma therapy naturally helps reduce Vata dosha in the body and stimulates specific points that regulate bone metabolism and enhance circulation. And that is key because by stimulating the Marma point, the therapy increases the flow of blood to the bones, ensuring that essential nutrients reach the astidati in the bone tissue, promoting better bone density and strength. Also, the nervous system is supported through Marma therapy because Marma therapy deeply calms the nervous system, which is crucial in the process of managing the stress and anxiety. And also, it helps in the relief of pain relief because the different therapies offered here are really something that I have seen in front of my eyes. Clients really rejuvenating themselves and feeling that in a relatively short amount of time, their osteoporosis markers have improved. So really talking here from experience. So the procedure for Marma therapy in osteoporosis in my practice goes as follows. We begin by warming the selected oils, usually makes them more absorbable. And we ensure that the environment is calm and the patient is very comfortable. And then we begin the application of the Marma oils to the selected Marma points. Now, in our tradition, we use specially designed transdermal creams, but we could also, of course, use herbalized, Ayurvedic oils like the Maharani oil, Bala Ashwagandha oil, Vata oil, with great success. So each point is being massaged in a circular clockwise motion. And then usually we apply some gentle pressure and hold the point for 2 to 3 minutes and or hold the point for 2 to 3 minutes. That really depends on which points you are working on. We'll go over these points in just a minute. So for optimal results, we always focus on both sides of the body, left and right, and front and back. So first point that we want to talk about is the point between the webbing of your fingers. Chakra is right here, located in the webbing between the thumb and index finger on the hand and between the big toe and the second toe on the foot, but it's also located between all the other fingers. But here is where we work mostly, applying the oils to the area by massaging the points in a stimulating manner, activating them by gentle circulating the oils over the Marma point and then holding the point for 2 to 3 minutes before releasing it. What that does is that this treatment benefits the circulation, pacifies Vata, and alleviates pain in the joints. Then we move to the back area. So on the lower back area, there is Katik Marma on the lower back, on either side of the back, below the spine, on the area of the sacrum that has these two little kind of dimples that you can observe. Here again, we're warming our Ayurvedic oils, and we activate the point by using, again, circular motion, using the warm oil, following with gentle pressure, outlining the Marma point only. Activating this Marma point strengthens the lower back, improves bone density, and relieves pain in the sacral and lumbar region. So if somebody has a more sensitive body constitution, sometimes just hovering over both Marma points with cupped hands can be efficient, but massaging around the outside of these little dimples on the back of the lower back there is very pleasant generally. We're going to move through the entire body region here. So we're going to come to Janu Marma, which is basically the center region of the kneecap. So there's actually a set of Marma points, but you can treat the entire Marma point area, and that is called Janu. So your kneecap. Here again, we prepare the Ayurvedic oils, and we apply the oil around the knee, gently massaging around the knee, and then gently press the center of the kneecap lightly, so never push down on the knee hard. And you can even like go on the outside of the knee with both hands, just pushing a little bit around the knee, but don't exert much pressure on top of the knee. This strengthens and supports the health joints, reduces stiffness, and hence bone strength in the knees. Then we're moving to Indrabasti Marma. So this is in the midpoint of the calf muscle. We also have this point on our arm, right in the midpoint of our arm. And here we are warming our healing oils. We use firm yet gentle massage strokes on the calf muscle, focusing on the midpoint, following by gentle pressure. And this helps improve the circulation of the lower limbs and reduces vata in the legs, stiffness, and supports the skeletal system. Then we're going to talk to Ani Marma. Ani Marma is kind of in the elbow region. So it's usually 3 finger joints above the elbow joint. And you can kind of feel it here as a little bit of an indentation. A wonderful place to apply Ashwagandha Vala oil and any other strength-giving oil here. So massage this point with clockwise motion again, focusing on both the inner and the outer points, and then do the same on the other side. You can do on both sides. This enhances joint mobility and reduces stiffness and promotes the strength of the upper limbs. So these Marma points can be massaged during an oil massage. So you could have an Abhyanga massage, weaving in these Marma points to help with the symptoms of osteoporosis. Or you can just do an entire oil massage following the Marma therapy. It's important to use the herbalized sesame oil that is infused sesame oil with the osteoporosis appropriate oil formula, and let the person either take a little steam afterwards to absorb the oils even further, and then let the person rest for a little bit. We encourage the patient to drink a lot of water to avoid any strenuous activity following the process. And to do this treatment, the Marma therapy in combination with the oil massage, at least once or twice a week for best results. For a couple of weeks. So 2 months, 3 months is highly recommended for this therapy to actually show results. But I also have my patients do Ayurvedic oil massage at home every day. So vastly important. So, and of course, offering this as part of the PanchaKarma process with the internal basti, cysteine treatments, perhaps herbal packs where we take the herbs appropriate for osteoporosis and rub them on the body in Udvartna, doing lepas, which are herbal pastes infused with the different bone strengthening herbs are incredibly important. Never underestimating that our skin is our largest organ, and absorption through the skin is incredibly beneficial. And then ingesting herbs internally, having a vata and pitta pacifying diet, full with warm, moist, nurturing foods, perhaps including some dairy. Sesame seeds, almonds, leafy greens are always highly recommended. Some calcium-rich foods are found in drumsticks, again, sesame seeds, leafy greens, and lots of warm spices with the ginger and cinnamon in the milk only to help the absorption of the milk and the switching of ghee to really drive it deep into the bone and marrow. So nothing, of course, makes as big of an impact as the things that you do every day. So it's important to do also weight-bearing exercises and strength training exercises to enhance bone density, to work on your daily stress reduction through meditation, pranayama, and yoga, and ensure adequate exposure to sunlight for natural vitamin D synthesis, and especially practice the yoga asanas that focus on bone strength, like the tree pose or the triangle pose. Very, very powerful. So again, it was a great honor to talk to you today here. My name is Corinna Maharani. You can contact me here via email. I'm looking forward to hear your feedback or any further questions that you might have. You can also visit me here at the Maharani Academy, School for PanchaKarma and Ayurveda. And I hope that you did enjoy my little presentation. And I'm very excited to be of service to you. And I hope that that we help together lots of people reducing osteoporosis symptoms and alleviate the this devastating disease as much as we can. So Ayurveda is here to help us save the day. Thank you so much, and enjoy learning more about Ayurveda, and more to come soon. So thank you and namaste.